Hi, I'm Dr. Charlie Liu, and today I'm going to be talking to you in this video about what to expect from a joint injection. So if you're watching this, it's quite possible that you've just talked to one of your doctors about a joint issue of some kind, perhaps it's osteoarthritis or rheumatoid arthritis, and they have discussed with you the possibility of having a joint injection. So I'm going to be talking today about what that involves, what you might expect afterwards, and possible side effects. So to start off with, let's go with the list of things that mean that you can't have a joint injection. So your doctor should have already asked you about this, but in case they've forgotten, if you have a prosthetic joint, i.e. a metal joint or a replaced joint, then we really shouldn't be doing a steroid injection except under very strict sterile circumstances. So that will usually be done by a surgeon in the operating theatre, not by a GP in their surgery. If you're immunosuppressed, so for example if you're on something like methotrexate, sulfasalazine, or an injection of a biological therapy like infliximab, or if you have any other medications that mean that your immune system is suppressed, then again you should tell your GP before you go ahead. If you're on an anticoagulant, so this is a bleeding medication like warfarin, or apixaban, rivaroxaban, or edoxaban, if you're on anything like that, again tell your GP. Aspirin is usually okay, so we do joint injections with aspirin and that doesn't usually cause any issues. And the other last two things that I usually mention are reasons that we should be cautious, but they're not an absolute no-no. So if you have diabetes and your sugars aren't very well controlled at the moment, or if you have high blood pressure and your blood pressures also aren't very well controlled at the moment, you can still have the steroid injection, but in most cases we'd probably prefer it if you got those slightly better under control, because steroids can sometimes worsen your sugars and worsen your blood pressure. So it's best to get that under control first before you go ahead with the steroid injection. So that's the bad stuff out the way. We'll talk about what you can expect from a steroid injection. Now, many of us in GP surgery do these now, and probably the most common ones that we do are the knees. We do carpal tunnel injections quite commonly. We sometimes do tendinitis, so at the wrist or at the elbow, but there are a couple of other joints that we do. There are certain joints that we generally don't do in the surgery, so hips we don't generally do, ankles we don't generally do, so that's mostly something that's done by the orthopaedic surgeons up at the hospital instead. So the joint injections involve an injection usually of a steroid. The one that I most commonly use is depomedrone, but there might be a variety of different steroids that are used, and depending on the joint and the procedure, we may also inject a little bit of some mild local anaesthetic as well. So the procedure usually goes that we ask you to come in and book a double appointment because it does take a little while. Your doctor will probably talk you through most of the information in this video again, just to make sure that you've understood it and you don't have any further questions. And then we clean the area very thoroughly, just to make sure that the skin is clean. We take up the steroid in a small needle, and then we inject it into the joint and just make sure that there's no bleeding after we've taken the needle out. The injection can be a bit painful, but it's not significantly more painful than, for example, a blood test in most cases. And actually, quite a lot of the time, people will turn around and say, I'm ready to have the injection, and I've already done it. So it's not as bad as most people think. The things that you might expect afterwards are that we usually ask people to rest for about 24 hours afterwards. Try not to do any exercise or any heavy lifting, particularly using that joint if possible. And that's just because you've had a needle in the joint, the tip of the needle, it's possible that it's touched some surfaces of the joint and there might be a bit of bleeding, so we don't want to exacerbate that anymore. So give it a good 24 hours or even 48 hours of rest if you can, and just let any bleeding and damage heal up within the joint before you go about your usual business. And then you can gradually get back to normal activity over the course of a week. The main serious side effect to mention is the risk of infection. Now this is very rare, so the statistics are that it happens less than 1 in 10,000 times out of every injection. I've never personally seen it happen, and I've also never known a colleague to have it happen to them. So that's the sort of level of rarity that we're talking. But if you do have an infection in the joint, then the joint will usually become quite red and hot and painful, and it may be swollen as well. And depending on how quickly you catch it, you may start to feel a bit unwell and get a fever. If anything like that happens, you should contact medical services straight away. If it's the weekend, don't wait until Monday to talk to your GP. You should be going to the A&E department straight away. Now, separate to that, there is the risk of a mild flare-up in pain, which is a separate thing. An infection is very serious, but you can get a mild flare-up of pain, but the joint is not red, not hot, not swollen, and that's much less serious and probably happens in about 1 in 50 cases, and the pain usually gets a little bit worse for a week or so before it then starts to get better again. And so that's nothing to get too worried about, but watch out for those things that I mentioned before: red joint, swollen joint, very painful, and a fever. In terms of the other minor side effects, so it can be quite common to get a little bit of dimpling of the skin where the needle has gone in. So you might find that there's a small skin dimple, and you might find that the colour of the skin has changed a little bit, so it can get a bit lighter or a bit darker in some cases. The steroid usually stays mostly within the joint, and it gradually seeps out into your system over the course of hopefully weeks or months. So in general, you shouldn't get many systemic side effects unless we've injected a lot of joints very frequently. And sometimes this is the case. If you've got quite severe rheumatoid arthritis, for example, you may be getting quite a lot of joint injections in the early stages before they've started getting your treatment under control. But if you're having that, if you're having quite a few joints injected and you're having them more than 3 monthly, then that should probably be taken care of by your rheumatologist and not by us. So we will generally do a single joint at a time, possibly 2, for example, if you've got both knees that have osteoarthritis, and we generally do a maximum of 4 a year. So systemic side effects are quite rare. Sometimes, like I said, it can cause your sugar levels to go up a little bit, so if you have diabetes, it's important to get this under control first, and it can sometimes send your blood pressure up a little bit, in which case you should also see your GP about getting your blood pressure under control. But the more severe systemic side effects that we see with high-dose steroids, we don't usually see with joint injections because the dose is small and it's spread out over a long period of time. But if you do notice things like a roundness of the face, getting excess fat on the face, stretch marks, easy bruising, easy bleeding, any of these things, and you're a bit worried, then do see your GP. It's likely to be unrelated to the steroids, but you may as well get it checked out. So the pain usually does settle down. Now, unfortunately, we do know that steroid injections don't really slow down the progression of arthritis necessarily. So if you have osteoarthritis, wear and tear arthritis, it can give relief for your symptoms, but it doesn't necessarily slow down the progression. So often we use it as a bit of a bridging therapy if painkillers and physiotherapy are not quite doing the trick, but you're not at the stage where you want to consider surgery. Often we use the steroids in between to give a little bit of relief, and usually the relief lasts for a few months. Sometimes, particularly in the first couple of times, we often get very long-lasting relief. That may last 6 months or a year before you need to have another one. And in my experience, we tend to find that the more injections you've had to give in one joint, the shorter the amount of time that it works for. So the first time you might get a year's relief, and the second time you might get 9 months relief, and then gradually it gets worse and worse. So hopefully that's been useful for you. If you do still have further questions, then do ask the GP who is doing your injection for you, and you can always back out on the day if you need to. If there are any other frequently asked questions that you'd like me to address, do leave it in the comments below, and I might do another video, or I might update this video depending on what you want to know. Alright, well, hopefully that's useful for you, and if you do get the joint injection, I hope it works well for you. Have a very nice day.